Hey everyone, and welcome to today's Explainer. I'm going to be your guide today, and as a neurologist, I can tell you firsthand that when it comes to the human brain, we are dealing with literally the most complex, delicate organ in the entire body. Now, dealing with a medical emergency involving the brain, yeah, that can feel completely overwhelming. But my goal today is to give you some calm, clear, and really evidence-based information. We're going to embark on a pretty high-stakes medical journey together to understand exactly what a stroke is, how we treat it, and honestly, most importantly, how we can prevent it. So let's just dive right in. 40 seconds. Just let that sink in for a moment. By the time I finish explaining these next few points to you, someone in the United States will have just suffered a stroke. It's a staggering statistic, right? But it really establishes the immediate urgency of what we're talking about today. A stroke can happen on your street, at your workplace, or right in your own living room. It's a sudden, critical event, but as we are going to see, it is absolutely one where having rapid knowledge and taking fast action can completely change the outcome. So, here is our clinical treatment plan for today's Explainer. We're going to cover 1. What is a brain attack? 2. Recognizing the warning signs. 3. Inside the emergency room. 4. Treatments that save brains. 5. The road to recovery. And 6. Preventing the next stroke. All right, let's start with the basics. Section 1. What is a brain attack? The mechanisms of stroke. A stroke is, essentially, a brain attack. It happens when the blood that brings oxygen and those vital nutrients to your brain just suddenly stops flowing. And without that oxygen, brain cells begin to die off very, very rapidly. In neurology, we have a saying, and it's a vital one. Time is brain. Every single passing minute without blood flow means more tissue is irreversibly damaged. That is exactly why taking immediate action is the absolute core of stroke medicine. I want you to think of your brain's vascular system kind of like the plumbing in a house. An ischemic stroke, which, by the way, is the most common type, is like a clogged pipe. A blood clot or debris physically blocks a blood vessel, and the flow just stops. On the flip side, a hemorrhagic stroke is more like a burst pipe. A weakened blood vessel actually ruptures and bleeds directly into the surrounding brain area. So, while the symptoms might look pretty similar to us on the outside, what's actually happening internally is entirely different. Now, sometimes a patient will experience what we call a transient ischemic attack, or a TI for short. This is a temporary blockage where blood flow stops for a little bit and then manages to restore itself, so symptoms often resolve in minutes or maybe hours. But make no mistake here, a TIA should never, ever be ignored. It acts as a severe warning sign. If you have had at least one TIA, you're almost 10 times more likely to have a full-blown stroke in the future. It is a massive, critical window of opportunity to seek emergency evaluation and prevent a much larger attack. Section 2. Recognizing the warning signs. How to spot a stroke. So the most crucial point for you is knowing how to spot those symptoms immediately. We use what's called the BEFAST protocol. Let's methodically break this down. B is for balance loss, so a sudden lack of coordination or dizziness. E is for eye changes, like suddenly getting blurry vision or losing vision altogether. F is for face drooping, usually just on one side. A is for arm weakness or numbness. S is for speech difficulty, maybe slurring words or having trouble understanding others. And T, well, that stands for time. Time to call 911 immediately. These symptoms hit suddenly, and calling 911 allows the MS folks to begin treatment right away and alert our hospital stroke team before the patient even rolls through the doors. Section 3. Inside the emergency room. The triage protocol. When a stroke code is called in the hospital, things move incredibly fast. Our multidisciplinary acute stroke team swings into action in a highly coordinated sequence. First up, we do a rapid clinical assessment and neurological exam. Second, and this is the big one, we rush the patient to brain imaging, typically a CT or MRI scan. We absolutely have to determine if we're dealing with a clogged pipe or a burst pipe, right? Plus, we need to rule out other things that can mimic a stroke, like a brain tumor. Finally, we run urgent blood tests and an EKG to check for infections, clotting speeds, and heart irregularities. Section 4. Treatments that save brains. Restoring blood flow. Remember earlier when I said time is brain? Well, This timeline shows you exactly why. We operate on very strict, time-sensitive treatment windows. If a patient gets to us within 0 to 4.5 hours of their first symptoms, we can administer an IV clot-busting drug like Alteplase, or TPA. It basically dissolves the clot medically. However, for larger clots, or if the patient arrives a bit later, we have up to 24 hours in some specific cases to perform an endovascular mechanical thrombectomy. It's this remarkable procedure where we literally navigate a tiny catheter up into the brain and use a stent retreater to physically pull that clot right out of the blocked vessel. And I really want to share this incredibly hopeful reality about modern medicine with you. According to the American Stroke Association, 91% of stroke patients who were treated with a stent retriever within 150 minutes of their first symptoms recovered with little to no disability. 91%. I mean, that is just the astounding power of getting the right treatment right away. But what if the imaging showed a hemorrhagic stroke, a bleed? Well, in that case, giving a clot-busting drug would be an absolute disaster. Instead, our interventions shift entirely towards stopping the blood loss and reducing pressure in the brain. We might use endovascular procedures to repair weak spots from the inside, or even perform a surgical treatment where we place a tiny metal clip directly on the ruptured vessel. We also aggressively give medications to bring the patient's blood pressure down and reduce the pressure building up inside the skull. Section 5. The Road to Recovery, Healing and Rehabilitation. The long-term impact of a stroke depends so much on which specific area of the brain was damaged. Because of the way our neural pathways actually cross over in the body, a right brain injury often affects movement and feeling on the left side of the body. And conversely, a left brain injury often affects movement on the right side. Also, because the left hemisphere is typically where our language centers live, a stroke on that side frequently causes speech and language disorders, which we call aphasia. Now, recovering from a stroke is a marathon. It is definitely not a sprint. It takes a whole interprofessional team dedicated to helping the patient rebuild those neural connections and regain their independence, which can take months or even years. This team is amazing. It includes neurologists and physiatrists overseeing the care, physical and occupational therapists restoring movement and daily life skills, speech pathologists working on communication and swallowing, and psychologists and social workers helping the patient and their family navigate the profound emotional changes that so often come with a stroke. Actually, there's a really crucial evidence-based caveat we have to observe in the hospital. While rehabilitation is totally essential, clinical guidelines show us that high-dose, very early mobilization, so getting up and moving a lot within the first 24 hours of stroke onset, should actually be avoided. Pushing a patient too hard, too fast in that acute 24-hour window can paradoxically reduce their chances of a favorable outcome down the road at the 3-month mark. Healing takes a really delicate, perfectly timed balance. Section 6. Preventing the next stroke. Managing your risk. The data from the World Stroke Organization gives us a crystal clear picture of exactly where we need to focus our efforts. When we look at the global stroke burden, metabolic risks, which include things like high blood pressure, high body mass index, and high glucose, they account for a massive 70.3% of the total stroke burden. Behavioral risks like smoking and a poor diet account for 46.6%, and environmental risks like air pollution make up 37.3%. So the absolute crucial takeaway here is this: high systolic blood pressure is the single largest risk factor for stroke worldwide. But here is the truly wonderful news. Most strokes are preventable. You genuinely have the power to manage these modifiable risks in partnership with your doctor. By actively controlling your blood pressure and glucose levels, maintaining a moderate weight, quitting smoking, exercising regularly, and eating a heart-healthy diet that's low in sodium, you are actively defending your brain. These aren't just nice lifestyle suggestions. They are actual medical treatments for your long-term vascular health. As we wrap up today's explainer, I really want to leave you with this core message from the American Stroke Association. Stroke is largely treatable. It's a matter of getting the right treatment right away. The days of a stroke just being an untreatable tragedy, those are behind us. We have incredible tools to save brain tissue and restore function, but we can only use them if we beat the clock. So I leave you with this provocative final thought. Do you know the BEFAST signs well enough to save a life today? Balance, eyes, face, arm, speech, time. Memorize them, teach them to your family. Because if those 40 seconds ever count down for someone you love, your knowledge is literally the very first treatment they will receive. Thank you so much for joining me on this explainer. Stay vigilant, stay healthy, and take care of your brain.